This is Dr. Ruby, and welcome to part 2 of the Human Movement System. Functional fitness, performance enhancement, injury prevention, reconditioning, and rehabilitation all require the development of optimum levels of functional strength and neuromuscular efficiency. In order to have good function, we need to have good and accurate movement. Function is described as the integrated multiplanar movement that requires acceleration, deceleration, and stabilization. We look at the idea that acceleration requires a concentric force, deceleration requires an eccentric force, and stabilization requires an isometric force. All of these movements and contractions will happen in the planes that we discussed in our last lecture, the sagittal, frontal, and transverse plane. Having strength in function, or what we call functional strength, requires the ability of the neuromusculoskeletal system to perform dynamic eccentric, isometric, and concentric contractions upon demand in a smooth, coordinated fashion during functional movements. We call this neuromuscular efficiency. This is the ability of the neuromuscular system to allow agonists, antagonists, synergists, stabilizers, and neutralizers to work synergistically to produce force, reduce force, and dynamically stabilize the entire kinetic chain in all three planes of motion. The ability of the neuromuscular system to produce the right amount of force at the right joint at the right time to allow for the right movement so we can be efficient. Traditional fitness, performance enhancement, reconditioning, and rehabilitation does not emphasize the development of functional strength or neuromuscular efficiency. Primarily, the emphasis is on force production in the sagittal plane. Most injuries occur during force reduction in the transverse plane. So does a traditional isolated approach really solve our problem? If we look at muscle function, basically how do muscles work during dynamic functional movements, we see that it isn't enough. It isn't enough to look at multiplanar motion and actions of muscles in different roles at the same time. So ultimately, if we know what muscles do during functional movements, it becomes much easier to design a functional exercise program. Key muscles have the ability to dominate in one plane of motion. However, all muscles work in all planes of motion to allow optimal neuromuscular efficiency. So ultimately, muscle function is a highly complex and integrated neurophysiological event that is controlled by the central nervous system. The central nervous system directs the pre-programmed patterns of movement, or motor programs, that can be modified in countless ways to react appropriately to the external environment. The external environment can give many opportunities for change, such as gravity or ground reaction forces, or momentum or external load, and the central nervous system has to be ready to take those sensations in and adapt the movement according to what's happening to the human movement system. So you can see that if you had a pre-programmed event, something that you do all of the time, your central nervous system is going to get very accustomed to that, kind of the idea that practice makes perfect. And if we continue to practice it over and over, it becomes more fluent in our nervous system and an easier function for us to perform. This can be good, but it can also be bad. For example, when a client sustains an injury, they may have a limp, so if they have injured their knee and they limp for maybe a week, it's going to change the movement pattern and the freedom of movement provided by the central nervous system. So even when the pain is gone, the client may retain that poor movement pattern, and this is sometimes how we get into less efficient patterns of movement. Ultimately, the central nervous system is designed to optimize the selection of muscle synergies and not to go into individual muscle contractions. So if we can practice and function like this in our workouts and in our rehabilitation, it'll make our functional movements better. So the current concepts in functional anatomy focus on the idea that there are two distinct yet interdependent muscle systems. First, the stabilization system. And in this system, we have both local stabilizers and global stabilizers. So if you aren't real familiar with what local and global means, a local muscle is a deep muscle. It usually crosses only one joint, and it is a smaller muscle overall. So examples of a local muscle might be some of the rotator cuff muscles in the shoulder, or the deep transverse abdominis muscle, the multifidus muscle. Those are all what we would call local stabilizers. Now we can also have what's called a global stabilizer. So a global muscle is a big muscle. I call them the big dummies, that move us around. And you could compare them to the local stabilizers and say that the local muscles are the glue that hold us together. So a global stabilizer might be the hamstring muscle. Even though it's a big mover muscle, it does stabilize the pelvis. We use it to hold us in a posterior tilt, and it functions as a stabilizer in that role, even though it's a global muscle that's a big mover. So then we can look at the other interdependent muscle system as the movement system. These are the mobilizers, and these are made up of all global muscles, all of the big muscles that generally cross more than one joint and have a lot of power in moving our bodies around in space. So again, some examples of the stabilizers. Local stabilizer could be a multifidus, transverse abdominis, the transversospinalis, or the deep neck flexors. Again, I call them the glue. I think that helps you remember what they do, what their role is, and that they're deep and they're small. They function through proprioception, so they have neuromuscular control. They provide a continuous activity that stabilizes throughout movement, so they're contractions that continue throughout the movement. They're independent of direction. They're independent of the direction of the movement, and they are generally isometric contractions with a maximal length of change, and they control neural positions. One example that we talked about in the last lecture was the idea that the paraspinal muscles, the deep paraspinal muscles, would be stabilizers when you do a squat. So we could think of some of those deep, small paraspinal muscles being local stabilizers, and how they hold the spine in a stabilized neutral position during a squat activity. Then looking at the global stabilizers, these are larger muscles that stabilize. They're global, so they do cross more than one joint most of the time. We have the internal oblique, the quadratus lumborum, the gluteus medius, the gluteus maximus, the rotator cuff muscles, the scapular stabilizers. These generally function to generate force or control range of motion. They are low load, eccentric, decelerating contractions. They have a non-continuous contraction. They turn on and they turn off, and the activity is direction dependent. Now, in contrast, we look at the movement group that's all made up of global muscles, all those big dummies that pull us around. The muscles in this group could include muscles such as the gastrocnemius, the hamstring, the quadriceps, the adductors, the external oblique, rectus abdominis, erector spinae, latissimus dorsi. The function of these muscles is truly force production and torque production. They provide concentric contractions with acceleration, and they're primarily in the sagittal plane. It is a non-continuous phasic contraction, and it is direction dependent. So when we look at the idea that these muscles can become imbalanced, that we see that they don't work together in a good, healthy relationship, we can see that things happen to these groups of muscles. For example, the stabilizers, they may have a delayed recruitment. So we start that squat, and we don't see those paraspinals kick on as early in the motion as they should. So maybe the pelvis slips into a posterior tilt because of that. And this could be caused by something like pain, or maybe a stiff joint, a pathology in a joint could cause this to happen. Or maybe we could see a hypermobile joint. Like, for example, if the SI joint were hypermobile, the paraspinals may not be able to stabilize that hypermobility in the joint. And this can lead to a synergistic dominance where instead of a stabilizer doing its function, something else does the function. For example, if those deep paraspinals aren't working to hold the spine in extension, the latissimus dorsi might take over and do that activity instead. And that's just going to sort of feed this whole muscle imbalance. So again, we look at relationships, and I use the example of a husband and wife, that these muscles, they have to work together and build a good relationship. The muscles work synergistically to reduce force, to dynamically stabilize, and concentrically produce force in all three planes of motion. And the central nervous system is designed to optimize the selection of how these muscles work together. So we think of the central nervous system as kind of the puppeteer that's helping the relationship along, and it's guiding which muscles do what and controlling when they turn on and when they turn off. So now let's take a closer look at the global muscle systems. These are the movement systems. The global muscles are predominantly larger muscles responsible for controlling the movement of the trunk and limbs, and they are also responsible for absorbing shock from the upper and lower extremities. These muscles have attachments at the pelvis, the rib cage, and or the lower extremities. And collectively, these four subsystems that we'll discuss work as an integrated functional unit. So we'll go over each of the subsystems now. We're going to just do an overview and know that we'll talk about these more throughout the course. I would like to refer you to a handout that's in the Module 1 area called the Final Summary. This is a grid that I created, kind of listing the muscles that are in each subsystem, the plane of action that's responsible, the common methods of action, their dysfunctions that'll happen when that subsystem is not working. So this may help you sort of understand better what these subsystems are responsible for. So the first subsystem that we'll talk about is the lateral subsystem, and within this subsystem we have the gluteus medius, the tensor fascia lata, the adductor complex, and the quadratus lumborum. This subsystem is primarily responsible for frontal plane stability. So if we see a dysfunction or a poor movement pattern within the frontal plane, it's probably because this subsystem is not working effectively or efficiently. Something like a medial collapse of the knees in a squat or a Trendelenburg gait in a single leg stand might be something that we see as a result of a lack of function in the lateral subsystem. The next subsystem that we'll talk about is the posterior oblique subsystem. The muscles involved in this system would be the latissimus dorsi and the gluteus maximus, and then they attach into the thoracolumbar fascia, so that thoracolumbar fascia has a big role in this system as well. The function of this system is to control movement within the transverse plane and to create a stabilization force in that plane. We also see it functioning in the sagittal plane. Now, these muscles provide stability to the SI joint, or the joint of the pelvis meeting the sacroiliac. So that it's the sacroiliac joints where the pelvis meets the sacrum. So if we have an instability there in the SI joint, it's probably due to a lack of function of this posterior oblique subsystem. The third subsystem is the anterior oblique subsystem. Some of the muscles involved in this system include the internal oblique and the hip adductor complex, and the external oblique and the hip external rotators. These muscles in this system are responsible for function in the transverse plane, and they provide a stabilization within the sagittal plane, a stabilization within the frontal plane as well. So we're looking at the transverse plane and the frontal plane with this subsystem. When this subsystem is not functioning properly, we see a lack of ability to keep the hip from internally rotating, and this can cause a lot of stress at the knee. So weakness of this subsystem will increase internal rotation of the femur and cause both the pelvis to move improperly and the knee to move improperly. The last subsystem is the deep longitudinal subsystem. The muscles involved in this system are muscles like the erector spinae, the thoracolumbar fascia, the biceps, and the perineals. These muscles function to control force transmission longitudinally from the ground to the trunk. So these are our shock absorber muscles, and they're going to be very helpful when we're running or we're doing jumping or impact. When there's a dysfunction here, we see a lot of impact happening at the SI joint, and we see SI joint instability and low back pain. Oftentimes, the weakness stems from a weak anterior tibialis, and it'll lead to an overactive biceps femoris or hamstring muscle and overactive latissimus dorsi that cause a great deal of dysfunction in the spine and in the pelvis. So like I said, we'll talk more about these subsystems, and in the discussion question for this module, I'm looking for you to look for a simple movement, something simple. So don't get complicated. I don't want you doing like the swing of a baseball bat or anything. Do something simple like stepping onto a curb or down from a curb or stepping to the side, something simple that you can easily analyze and incorporate these subsystems into that small movement. So all of these movements that we've discussed in this lecture come together to make our integrated human movement. So we're looking at local muscles and global muscles functioning as stabilizers, mostly the local muscles as stabilizers, the global muscles both as stabilizers and as movers, but ultimately the central nervous system being the thing, or being the roller that's going to function or determine how these muscles are going to function together. And this picture kind of says it all. If those muscles aren't functioning well in a good relationship, ends up that some of the muscles just can't do their job because they aren't set up for that efficient movement in any way. So I hope that this helps you understand, and if you go ahead and do the reading and use the final summary and move on to the discussion part of Module 1. Hello, this is Dr. Ruby, and welcome to Part 2 of the